in school will be asked to wear a face covering when working within 3 feet of any student. In addition to that, we have some layers of safety that we would like to keep in place. We would like to keep social distancing in place with a distance of 3 feet as much as feasible. We will continue hygiene training, and we will ask that parents do home system screening. There's an updated version of this that CDC sent out, and it will be within this guide that goes out if approved tonight. In addition to that, we are also recommending optional, and I want to make sure that everybody understands that this is optional school-based pool testing. In addition, we are also offering optional rapid antigen testing for those that are symptomatic. Again, it's optional. It will require parental approval before any of that can happen. As far as busing goes, I think I stated at the last meeting, but I just want to kind of reiterate that if a child is on a bus, it's considered public transportation, and all students and staff must be masked on the bus. And with that said, all of this is subject to change. So that is basically our recommendation. All other building safety, things that have been in place will continue. Our ventilation system's up to code. We will continue to hand sanitize. We will have signage all over the building. Our middle school and high school classrooms will be wiped down at least once a day. Every learning space has an air filtration unit, and the use of plexiglass dividers where appropriate. One thing I will say is that we are planning as of now to serve lunch upstairs, and we will distance kids 3 feet while they eat, which is really kind of exciting. So I guess I'll turn it back over to Mrs. Richards.
Thank you, Georgia. So prior to the board having an opportunity to discuss this and actually put it into a full motion, we'd like to open this up to public comment. We know that a lot of you are here, have an attitude, an investment, a concern about this particular issue. But I'd like to establish a few ground rules. We hope that this is a thoughtful and civil conversation, that people will actively listen to one another. Please feel free to ask us any questions that you have. If we have an answer to that question, we'll be very happy to share that with you. Lindsay is here in her capacity, and I'm sure she'll be in a position to answer many of those questions for you. If someone has already come to the podium and expressed a concern or a position on this particular issue, and we've discussed it, let's try not to have repetitious comments regarding the same positions that someone else has already forwarded. That's not to silence anyone from having the opportunity to share what they think or feel about this issue. We know that everyone has legitimate concerns, and we feel as a board that our primary responsibility is to make a decision that creates the safest environment for students in the building. And that's really the predicate under which we'll make this decision for you. But we'll start by opening it up to public comment.
Can I get a clarification? I think I misunderstood.
Yes.
I think I misunderstood.
Could you state your name first?
Jacqueline Cook.
Okay.
I would like a clarification on what the mask protocol would be, because I think I misunderstood.
Okay. What did you understand the mask protocol to be?
At first I thought she said it was recommended to mask
That's correct.
for everyone in class, and then I heard the words parents' choice.
Well, recommendation, the Department of Education, the Maine CDC, and the Maine Principals Association, as well as Maine School Management Association, as well as the governor's office, have all come out and made the statement that because of the status of COVID in the state of Maine, we're not considered a hotspot. Therefore, they are only recommending, not mandating, mask wearing in schools. And that is consistent with the same organizations we have looked to in the past for advice about what to do or how to operate within the building. So having said that, our recommendation is that it will be parental choice for students in the building, whether their children wear a mask or do not wear a mask in the building. But we're asking that, obviously by state law, students need to wear a mask on a bus. By our recommendation, if a teacher is interacting with a child in a 3-foot space of distance, that they have a mask on while they're doing so. Okay. Yes. First comment. Could you please state your name?
My name is Jessica Dufour Champagne. I'm nervous. It's a dangerous place for me to be right now with my health. But I'm here tonight because I'm concerned for my children, the younger students, and others like myself who are immunocompromised and unable to receive vaccination. I'd like to read a short statement so I don't forget important issues. With the rise in COVID cases in Maine as well as nationwide, the simple act of wearing a mask can be that ounce of prevention that is worth a pound of cure. We all know that traditionally the beginning of the school year triggered an increase in other viruses in children and in turn their families. The use of masks due to COVID proved how effective masks are, as cold and flu cases were extremely low last year. Masks help prevent the spread of contagion, so why wait for disaster? Why wait until a student or multiple students end up very sick? Let's be proactive instead of reactive. An important note is that every time the school had to resort to quarantine methods last school year, at least one full day of learning was lost each time. Along those lines, the American Academy of Pediatrics notes that mask wearing protects unvaccinated individuals and could reduce transmission of other respiratory illnesses that keep students and staff home. Given what is known about low rates of in-school transmission when proper prevention methods are used, the AAP also states that masks do not affect carbon dioxide and recommends with the CDC for universal mask wearing for K-12 schools. The CDC also recommends that masks be worn in indoor public settings for everyone, including vaccinated people, who can still spread the virus, especially now with the Delta variant and increased transmissibility. As stated in the school handbook, buses are an extension of the classroom. If we tell our students this, and masks are mandatory on buses, how can we limit that protection to just that public area of the school? It should be extended in turn to the school itself. Mount Hope School District has decided to make masks and face shields mandatory for pre-K through 12, with masks optional as long as shields are used by students and teachers in grades 9 through 12 who will be vaccinated. Unfortunately, our school system is all in one building. We cannot let our most vulnerable students be put at risk of being in the same building as unmasked students and staff. I bring this up since our Boston Tech students will have exposure to more than one school district. I strongly and passionately request that a mask mandate is kept in place to keep all students, staff, and family members safe until there's a significant change in this virus. Full testing without mask mandates doesn't stop COVID from entering the school. It is just an identification method. We don't want to look back at this school year and say, I wish we had done more.
Yes. Yes.
Brian Video, Dallas. There's a lot of what was just said that I agree with, so I'll try not to repeat all that. The first thing I'd like to do is I understand that in the last board meeting there was some information presented to the board about the dangers of carbon dioxide buildup in masks in children. I saw 3 of those attachments that I think that was given to you. The first one referenced the JAMA article that has since been retracted because the methodology was incorrect for the experiment, and therefore their conclusions were flawed and it was retracted. The other 2 come from the Journal of Environmental Research and Public Health. This is I'll use the term journal loosely, you pay a fee to get published in this journal. You don't pay fees to get published in respectable journals. This is somebody who couldn't get published somewhere else who's putting stuff out there. Those were the other two articles. The words parents' choice were used tonight, and I feel like that's a fallacy. Parents' choice is based on a false premise that a parent makes a choice about their child and it only impacts their child. In this case, that is not what happens. If a child comes to school with COVID without a mask on and spreads it, that impacts other children. So parents' choice does not apply in this case. The universal mask policy mandate, that is the only way to protect as many kids as possible and keep them in school as many days as possible during the school year. The DOE, the Department of Education in Maine, recently added a caveat to their guidelines, that one of those caveats being, if there is universal masking in place in the school for staff and students, if there is a positive case in the school, if everybody had a mask on, you were no longer considered a close contact if that came into school, meaning that the rest of the kids get to continue going to school and getting an education in person and not going remote. The only person who would be required to quarantine at home would be the person who was positive. If our goal last year was to keep as many kids in school as many days as possible, I assume that that is also the goal this year. If that's the case, the universal mask mandate is the best and only way to do that. As you said, the pool testing is great, but it's reactive, it's not proactive. A preventative measure is a universal mask mandate. The last thing I'll say is, well, there's two things. One, a year ago today, in August, compared to a year ago or today, this August, which isn't even over yet, there's a month to go, the rate of COVID cases in Franklin County are 30 times higher than they were a year ago in August. But we're considering doing less this year than we did last year. I don't think that's all right. The last thing I'll say is just to reach out to some heartstrings here. There are people in this community, staff, students, who are immune compromised, who, even if they've had a vaccine, may still be able to get extremely sick from this. There are people who are ineligible for a vaccine. Half the school, pre-K to 5, is not eligible yet. We should be looking out for the people who can't look out for themselves. That's what a community does, and that's what I would expect a small community, especially like Rangeley, to do, is take care of each other. Rangeley Rises should be more than just 2 words. We should be continuing to take care of those who can't take care of themselves yet. And a mask is not an onerous task. It's a very simple thing, and the stuff we've heard about the dangers of it, I don't know how else to put it, but it's bogus. The American Academy of Pediatrics, the American Medical Association, the CDC, are not going to put out information that's going to be harmful to kids. They're just not going to do it. So I appreciate the time to speak, and I appreciate all the work the board is doing and the decisions you have to make. Thank you.
I want to first thank you for your recommendation. I think it's a lot, and you're giving parents the choice to do what's best for their children and their family, and I thank you for that. One of the reasons, well, I have many here, so bear with me. I think masks should be optional. The reason why is a research study done in Germany, led by the University of Whitby, reviewed data on 25,930 children. It was reported that 68% of these children had impairments from wearing masks. The impairments included irritability, headache, difficulty, concentrating, depression, reluctance to go to school, malice, impaired learning, drowsiness and fatigue, feeling short of breath, dizziness, and willingness to move or play, nausea, and tachycardia. The highest percentage of these impairments were in children ages 13 to 18. 68% of 25,930. Let's look at this in regards to school-age children in the United States. There are 56.6 million students in the United States. There are currently, so if we look at 68% of this, that's 38.5 million students who are suffering from an impairment from wearing a mask. There were 179 deaths from COVID in 2020 in children and school-age children. The amount of kids tested positive for COVID is also much less than this 38.5 million. Morgan Stanley Children's Hospital of New York Presbyterian reported in a journal of infectious diseases and epidemiology side effects of prolonged use of PPE. And this is nurses that are working in New York City. and how long they're wearing PPE. This study of health workers, primarily in New York City, these health workers reported headaches, rash, acne, impaired cognition, with 1 to 3 hours within 1 to 3 hours of wearing the mask. The Journal of American Medical Association published research letter dated June 30th, 2021, stating that there are high levels of carbon dioxide detected in children wearing masks. And this is one of those articles that are published and you don't have to pay. The normal content of carbon in open area is 400 parts per million. OSHA has allowed a CO2 limit of 5,000 parts per million. The levels of CO2 found in the study were more than double this amount. The University of Florida lab analyzed a sample of protective masks sent in by parents of kids that wore these masks for 5 to 8 hours. What they found was alarming, as you can imagine. They found strains of pneumonia-causing bacteria, strains of meningitis-causing bacteria, and dangerous antibiotic-resistant bacterial pathogens. They also found that there are pathogens that cause fever, ulcers, acne, yeast infections, periodontal disease, and strep throat. These things are not just in the kids' masks. Do masks work for COVID-19? According to an article that was published in PubMed, they found that masks can reduce emission of influenza virus particles in forms of droplets, but not aerosol. Increasing data has shown that viral aerosol is a central transmission route for coronavirus and influenza, meaning that it's so small that it goes through the mask. An article posted in Clinical Infectious Disease, June 2021, did a study drawing from cases in 12 countries. The United States was included in this. They found that children are frequently identified as an index case in household transmission. They too identified that children 18 and younger are significantly less likely to acquire COVID than their adult family members. Since the home has been the most common place for COVID to be spread, it would stand to reason children are not spreading COVID in school. According to the CDC in 2021, so far, there was 163 deaths to those 17 and younger. The total reported deaths were 249,282. School-age kids account for only 1/10 of 1% of these deaths. There were more flu deaths in 2020 for 17 and younger. I guess this would be the same this year, but remarkably, flu cases have gone down 180%. This seems odd, or does a drastic change only reinforce the CDC's decision to withdraw the use of the PCR diagnostic panel because it does detect the flu and COVID? I have a senior, and I respect everybody's opinion, but these kids have gone all summer without masks. They have been around with friends, they have played sports, they have gone to concerts. They don't deserve to go backwards. Not at all. The real pandemic is adolescent depression, suicidal ideation, drug and alcohol abuse. So let's focus on that and not forcing these kids to put masks on their face. Thank you.
Other comments? Yes. Please state your name.
My name is Dax Lawrence. I'm a student here at Ranger Christian Schools. I just had a few questions about whether or not we go to a mandate or a recommendation. My first question is, if we do choose to go to a mask mandate, how will that impact extracurricular activities? Say, for example, theater programs, like for example, the upcoming musical within the fall. How will that impact the kids participating in that? And if we are required to use masks, how are we going to make it as one enjoyable and one safe and cooperative environment for the students to participate in?
Those are all good questions, Daxton, and not anything that we have an answer to at this point. I think if you, it would, we would give a recommendation as to what we as a school would like if this was something that was happening in the theater, but I believe it would ultimately be their decision as to how that plays out. But again, you know, I can't answer that question at this point in time.
My name is Sarah England, I'm a new parent to the school, and I just have a question or clarification. Or if we were to move into a situation where...
Could you speak a little bit more into the mic, because I can't.
Yeah, sorry. Is this better? Should I say my name again?
That's okay.
Okay. So I just am curious with states that have mandated masks, what type of masks do they mandate? Because the data in the medical journals vary significantly. And there's a lack of specification oftentimes as to the type of mask that's being examined, whether it's cloth, surgical masks, which, you know, they have to do this in order of probably protection for the micron size of the particles. I'm a molecular scientist, so I do comprehend what I'm reading. But, you know, the N95s as well, you know, the double masking. Do you have any information as to what type of mask is required for the public transportation and or, you know, if we were to move into a state of mandate, because if the numbers are rising, it's a feasibility? So just wondering about the information on that.
Lindsay, can you answer that?
Yeah, and I can answer it quickly without the mic. So our requirement has always been that it's a double layered mask, surgical, or a cloth one, but it always has to be more than one layer. Most schools were not allowing gaiters. At one point, we were okay with them, but again, it could not be a single layer. It has to be more than one layer to the face covering in order for it to meet the criteria. So,
Are the N95s allowed?
we don't supply N95s for kids. If they wore them to school, that would be okay. Usually, the actual N95 they were saving for healthcare workers. We did get a state supply of the KN95s, which is a little bit different, but we do have that. Most students wouldn't put those on because
Well, I
they
mean,
kind of like cones forward.
They do, and they're very much restrict, like oxygen flow. So they're, you know, to somebody's point that, you know, the extended number of, you know, minutes that a student is wearing is like 280 in a day or something like that. So it's extensive, and it is, you know, I do get concerned for that longitudinal, you know, data around that length of time, because even for healthcare professionals, I know that could be a cognition, you know, impact and things like that. So I was just curious if there was a...
So right now, as far as the N95, I was the only one that had them in the building, and I actually never had to wear it. I was not in a situation where I had to. So,
Thank you.
Other comments?
Hi, Jacqueline Peck. My son Charlie Allen is going third grade, and he has always had amazing grades, and his teachers always love him. He's very, very social, and he recently told me that if he has to wear a mask to school, that he would rather stay home. And I know that there has been a lot of conflicting information scientifically with studies, but I think that the psychological damage done by masks is a little bit more concerning to me, especially with my child. So I think it's honorable that you guys are making a parent's choice, because it makes it a little bit less difficult for me to feel like I am doing the wrong thing by him and what he wants as a human being. That's all I have to say. Thank you.
Thank you. I just want to make sure that, you know, with that said, with the recommendation that's being brought forth, we as an administration would like to be able to make a decision of to mask up at any point in time if need be. So we want the flexibility to be able to do that based on something that might be happening in the building or something that might be happening in our community that might tie back to the building. for a day, a week, whatever we needed to do until we got on the other side of that. So I just want to make sure that we have that flexibility to do that as well.
Other comments, please.
Just to be clear, that's one part that concerns me slightly. Will there be an emergency board meeting to discuss that, or will it just be we've made this decision, this is what's going to happen?
We would like to be able to make the decision. We might need to make it in a sort of an emergency fashion. And so we would like the flexibility to be able to do that. It would just be a safety measure that we feel is important to have in place. And, if for whatever reason deemed necessary.
Completely understand that. What would be the plan to go back towards option? What would be your guidelines?
We would communicate that out. It would be communicated clearly out to all parents.
So we've had an outbreak, kids are going to need to wear masks for the next 14 days, and after that, you're going to...
Yeah, we will communicate that out.
How difficult do you think that's going to be to explain to the kid?
I mean, believe it or not, kids have been wearing masks for a year now in school, and they adapted very well. And if we said, you know what, at some point in time, guys, you might have to put a mask on, I don't think it's really going to, affect them one way or the other. They've been wearing them for a long time now, and I think they understand.
Thank you. And I would just add, that decision would be inconsistent with how last year followed through with the few times that we had to suspend in school learning and go to remote learning because we had contact cases in the building or individuals in the building who had become sick. So it's important that the administration has the opportunity and the authority to make a determination based on information from our school health nurse and community health personnel as to whether or not it's important to mask up for a period of time. Maybe it would be a section of the building. It might not be the entire building, but that would be up to administrative discretion.
I think that alternative is better than closing the school down and going remote.
Yeah, and I just want to clarify that too. Maybe this would be a good time for Lindsay to talk about what exempts somebody from having to quarantine, because that's really important information. And basically, if we get into a situation where we may have a case or two in school and we opt to mask up, then we have much less kids having to quarantine. So it protects us. But Lindsay, would you like to talk about what exempts us from having to quarantine? Because that's really, really important.
Everybody knows my favorite thing to do is speak in front of large people. So per the standard operating procedure that was released by the state, which we had not had at the last meeting, they have put out what will get somebody out of quarantine. And there are 4 exemptions that keep your child in school if they were exposed. The first one is the close contact is vaccinated fully, meaning that they've had their series and they are 14 days past their second dose or their first one if they have the Johnson & Johnson. So that they would be okay for that. If they are not fully vaccinated, then that would be different. If the close contact, whether it be staff or student, has a previous positive COVID test within 90 days, which it has been consistent pretty much all along. Third, the close contact, whether it's staff or student, participates in weekly school pool testing, and the exposure was a school exposure. So if we opt to do the pool testing, if your child or a staff member was exposed outside of school, they do still have to follow whatever quarantine or isolation that the CDC tells them. It's only for school exposure would they not have to quarantine based on if they participate in pool testing. So they could participate in class, extracurricular activities associated with the school. So that may answer a little bit of that question you had, Dax. Yes. So, but as far as going out into the community, it would technically have to be in a quarantine outside of those school-related activities. And the fourth would be that the school has a mandatory masking policy. If we did have one where everybody was required to wear a mask, then the exposed students do not have to quarantine from the regular school day, as long as they were 3 feet from the affected student and had no direct physical contact. So, and that is only for classroom exposure only, with the mandatory mask. It doesn't apply for if they were exposed in the cafeteria or a bus, or it's only in the classroom. And I just want to also, I know this is going to come up at some point, but for sports teams, per the SOP, you are only exempt from being a close contact, from quarantine as a close contact for a sports team if you participate in pool testing or you are vaccinated and asymptomatic. There is no other way, because in most sports you are in direct contact with that.
Questions for Leslie on this?
Lindsay, I may have missed this, but
Yes.
can you explain pool testing?
Yes, I will explain pool testing again. Okay, so pool testing is a PCR test that is done in certain places in the building. So we would come up with, whether it's each classroom counts as their own pool, or if we had like pre-K, kindergarten, first grade, all of their own pools. So the recommendation is that you have a minimum of 5 and a maximum of 25 in each of your pools per testing. So 1 day a week, those that opted in to be pool testing would do a self-swab. And actually, pretty much every kid at all ages can do that, because it's really at the bottom of your nose. It is not the nasopharyngeal one. It is at the anterior, so it's just the lower part of your nose. Turn it a couple times, and all of those who are participating, their swab goes into one vial, and it gets sent out, and we overnighter. Actually, I don't really know if that exists, but overnight, and then we get the results. Now, if the pool itself comes back positive, then what happens is those students who are in the pool will get tested with the rapid test. Again, same swab, it's partly into the nose, and to see who the positive person is. Then from there, that whoever's positive would have to do the isolation, and all of those who were in that classroom who participated in the pool testing would be able to resume their activities.
So your child have to swab twice.
Yes. If the pool comes back positive, they would have to swab twice.
Yes, we are the family that chooses not to pool test and not to test our kids. Our kids could potentially be out of school for months. If they come back and there's another positive case, so then they're on quarantine again because we're not doing
If it's the pool, then
but it's still the same classroom. So what is the plan for those kids that have to stay home? Are we going to do remote? I mean, there has to be a plan. No, but if you're not going to do testing, it's a parental choice.
There's another option.
Our instructional plan, we plan open 5 days a week. But if your child's asked to quarantine due to COVID-19 or RLRS provided, this is starting option. For pre-K through 5, it would be asynchronous like last year. There'd be packets to prepare them. It might be a day. You have to get those ready. Those will be sent home. We hope it wouldn't be months and months.
But
5 to 10 days. But, and then for 6 through 12, we're going to do a blended learning. We found last year, strictly remote Zooming worked really well for some families. For some, it did not. So we want to be able to deal with it on a case-by-case basis so they can plan that best meets that student. We just think that's the best method. End up with teams, and that's what came out of that. You know, I'm an educator, I'm not a scientist or a medical professional. My priority here is educating kids. And to do that, to allow teachers to do their job, I need kids in school as much as possible, with as little as quarantine. So with our recommendation as parents, I just ask you to make a choice. You're going to do what you're going to do, but make a choice that there are choices here where your kid potentially would never have to quarantine. They could stay in school even if they were sitting 3 feet from somebody who was positive and wearing a mask. That is parent choice. You know, when we think about kids wearing at the end of last year, they'd be in the building wearing masks, they go out to the playground, you'd have to remind them they can take them off. They'd be playing, like when we did, when we started baseball, I did Cal Ripken, the kids would come with masks and they'd like, oh, you can take those off, and they'd almost like still wear them. So they did adapt, some kids didn't like it as much, but as an educator, I just ask that we make choices to keep kids in this building, because it is not easy to educate kids when they're not here. So.
Okay, so it would be up to the parent for 6 through 12 if their child did Zoom, that's my concern.
We would make a plan that we're preparing the student to make a plan that works. For some kids, Zooming worked, some kids it didn't work, we make a plan on a case-by-case basis.
Michelle Liberty. As a parent, I appreciate all this hard work that everybody's done, because I know it hasn't been easy for anyone, but as a parent, I was really hoping that we would start the year with masks for everybody, and trust me, I do not want masks. My kids don't want to wear masks. I worked with students last year that seemed to be okay during school, even the little ones. And like what Justin just said, it's true. I would rather wear masks than go remote. And I feel like if we started the school with masks, we could see how things go. I mean, Brewster County was open for a day and they had to go remote. And I just don't want that to happen for our kids. And I can see everybody's side, but to me, it's the safe thing is do what we did last year. Start with masks. It's easier to let up than put on.
Lindsay, can you just confirm something? When I read the DOE guidelines with the only way that you don't have to quarantine if you're a close contact is if the school actually has a universal mask mandate in place, correct? I thought the note after the table.
Can we just wait and let the person at the podium speak?
Sure.
And then I'll invite you to come up.
I'm sorry, I thought you pointed to me, Mary. I'm sorry.
Good evening. My name is Robin George. I'm a middle school teacher here. Thank you to everybody for your hard work. We are a community. It's best when we work together. I know there are different opinions. I didn't plan on speaking tonight, and part of the reason for that is because I, as well as many of my colleagues, have written letters to you as members of the school board. So I'm hoping that you were able to read those letters and reflect. One thing that I'd like to say is that I listened to Dr. Shaw today for the briefing, and he indicated that last year at this time, parents were contracting, or adults were contracting COVID at a much higher rate than kids. He said that's changed. The cases are rising in tandem, and he suggested that maybe the factor is the Delta variant. Like Ryan said, I think it's a fallacy to say that the guidance from the American Academy of Pediatrics and the CDC, national and both state, are supporting parental choice. I think that the reason this was mentioned in the briefing today, the reason that there aren't more towns mandating masks right now is because the state of emergency has ended. The state government is going to weigh whether there's really a reason to bring it back or not. I'm not suggesting that you said they would, but that's a factor, right? They've gotten this far. So I think that when the American Academy of Pediatrics the United States Centers for Disease Control and the Maine Centers for Disease Control tell us that they're recommending that we mask students. They're not saying parents make a choice. They're saying we recommend that everybody in the building be masked. That's different. That's a different interpretation. There may be the variability that allows us to see it that way, but I don't think that's what they're saying. They're not saying, do what you feel like. Whatever you think is good. No, they're saying they recommend it. Lastly, so we do pool testing. I'm just curious, and I'm not asking anyone right now, but I'm wondering, like, if parents don't want masks, how likely are they going to be to have their child pool tested? Maybe there's some reluctance. I'm not judging it. I'm just saying that we might not catch cases. Like Michelle, I believe the way to deal with this is to start Europe strong while cases are going up, and to then be able to ease up, because we know that it's going to get better. It did last year. We were so hopeful in June, and it will happen this year too. This surge will pass, and we'll be able to ease up. Thank you.
So real quick, I don't have my glasses. I'm going to try to read it. This is the main DOE guidelines. They're talking about close contacts being quarantined, and one of the exceptions, number 4, says the school has a mandatory masking policy. That's the only way that a close contact does not need to quarantine, in other words, go home and do remote learning for an extended period of time. If we're looking to have kids in the classroom as much as possible this year, the only way to do that is a mandatory masking policy.
Sorry, go ahead. Justin Williams. Rachel, you don't need environment. My kids live.
I'm sorry, I can't.
My kids, Range is its own unique environment. My kids outside of school with Gordon's kids, Caleb's kids, Danielle's kids, Patty's kids. I don't think they put our But the point, Daxton Road, it's its own unique environment. So if we mask in school, yes, that protects everybody in the school, but you still got everybody plays with everybody in this town. You can't keep that aspect of it. So as much as having a mask would help, it's not going to stop. It's going to, those that want a mask should mask. Because outside of school, my kid's not wearing a mask. You know, and I fully plan on having my child wear, I'm going to sign her for pool testing. My concern was the brain swab. As long as it's not going to hurt her, fine. If it helps everybody, great. But don't make my kid wear a mask in school. Unless absolutely necessary, again, I'd rather have them here learning license. 100%. But if it's not 100% necessary, it's kind of pointless. Emma's playing with Solly and Maddie after school wings, right?
Yes. Hello, Kelsey Oreskes. I'm a middle school teacher and a parent of an elementary teacher. I as well was not going to speak. I wrote a letter as well to the school board. I hope that you were all able to receive that and read it. I'm not speaking from a scientific point of view because I'm not a scientist. There's so much information out there. It's very difficult for me to understand, to not understand, but to sift through it and decide, just decide. So I just feel like there's so much information out there that I'm not a professional, so I'm going to leave that to the scientists and medical profession. My child is also a member of this community, and we don't play with everybody. We've actually kept our bubble very small. I have an immunocompromised mother who I didn't see for a month and a half over the holidays. So to that, I would say the argument that everyone's playing with everyone's not necessarily true. I say that with all due respect. I have friends on both sides sitting in this room right now, and I have empathy for both sides because this is not a pleasant thing. It's not a pleasant time. it happens, maybe once a century in our history that we're dealing with this. It's just an extraordinary time that we're in. And I have a lot of love for people on both sides, and I know it's not an easy decision. So my child does still wear a mask when we're in the community because I'm trying to protect my family, my community, him, who is not able to be vaccinated. So the premise of the letter that I wrote is from an educational point of view. I can speak to that because I'm in the classroom, and I find that the best thing for kids in the classroom is structure and consistency, and that's what allows kids to learn when they have parameters to operate within, expectations, and clear guidelines. When you don't have those, I believe that teaching is not as effective because there's just too much gray area. So my concern is if we are recommendation only, that we've now set a learning environment and a social environment where that gray area exists, and there's not that clarity. I've really kept my son out of the politics of this conversation. He just knows we wear a mask because we're protecting your grandmother and other people, and you're not vaccinated. I haven't gotten into any of my views with him beyond that, and it was funny because after I wrote that letter, which I didn't even mention to him, he said to me, "Am I going to have to wear a mask at school?" And I said, "Yeah, you are. You're not vaccinated, and it's the safest thing we can do." And he said, "I really don't want to be the only kid in my class not wearing a mask." And I feel like there's a lot of emotional impact, I know, on kids from having to wear a mask. I did it for 7-8 hours a day last year. I didn't love it, but it was fine. And he did it too, and honestly never complained. And I would remind him, "You take it off now, we're outside." So my concern is that the larger emotional impact will be the inconsistency in seeing some kids wearing them, some kids not. I walked in tonight and I walked past people that I think fondly of, and I felt like this is really awkward because we're on two different sides of this. I've known some of you for 20 years and I have a lot of love for you, and I felt like, oh God, I'm walking through this gauntlet. This is really awkward. I don't want my 7-year-old to have to feel that in his classroom. So my fear is if we are inconsistent with the message we send to our kids, that's actually going to lead to more social and emotional issues, peer pressure as well. And to answer the question, I think Justin, you had said, how do I explain to my kid this idea of, okay, if you put on a mask now, you didn't have to have one before. If we all just wore one, then I think it would take some of that confusion away. I respectfully state that for everybody. I have no personal animosity towards people. Our world is in a really difficult situation. So I thank you all for listening, and thank you for the very difficult job that you're doing. I know it's very hard, and I appreciate it. Time for a couple more comments. I think we've done a pretty good job of covering the waterfront of your concerns and your questions. So I'll let 2 more folks come to the podium, if that's all right.
Hi, Catherine Kay. At the last board meeting, Lindsay, I had asked about what the accuracy rates were for the 2 different tests, the PCR and the rapid testing. I was wondering if you have those numbers.
And
Could you use your mic, because I can't.
I forgot I had it in my hand. Sorry. No, I do not have that. I had tried to write down all of the things I needed to find out for tonight's meeting, and that was, and as soon as I saw you, I remembered that was not, but I can get that information for you. I really will. I just don't have it right now, and I apologize.
Sounds okay. I just have a fear that if the tests aren't very accurate, I don't want to see kids quarantined for no reason if it's a false positive. Yeah.
I did happen to go back, maybe this is a rough idea, as far as pool testing. So as of July 28th, and we did talk about how many other schools were doing pool testing, there was 166 schools enrolled, 16 counties represented. So 45% participation rate in the enrolled schools. Didn't mean that they had necessarily necessarily started it, but they had agreed to the program and already got consent from parents. So most of them were averaging 45%. There was 138 pools that they did for summer programming that they were getting reports of, and only one positive pool out of 138. So I would like to think that's not a huge amount of false positives, because there was only one positive pool that had come out of just that number. So,
And just one other thing, just a clarification. Since I'm sure at some point masking will be mandatory again during the school year, was I mistaken when I heard that quarantine would be a little bit less strict? Because last year when masks was mandatory, if there was a close contact in the school, everyone was home, and it happened multiple times.
So if we went to a mandatory masking, universal masking, everybody wore masks, then yes, that would by definition, per the SOP, as long as they maintained 3 feet from an infected individual, then they wouldn't have to quarantine. From a positive case in their classroom.
So it's less strict than last year?
Yes.
Thank you.
Yeah, and it does depend, like it would be if it was a student in their classroom, only in their classroom with that universal masking policy take effect as far as the quarantine. Like they had said Aroostook County, that was a teacher, and teachers is a little bit different because of if they go into in a high school level, all kids are coming into their classrooms, so it's a little bit different on the SOP. So it's a lot to
One last comment, and I appreciate if you could be at the podium, so I can hear.
Okay, so say you did the pool testing for my youngest kid's class, and he was not doing the pool testing, he had to quarantine. Does that mean that my other 2 children have to quarantine also? Okay, thank you.
It's only based on your close contact to a positive, it's not, same as last year.
And I appreciate the fact that you all turned out tonight. I know this is a really important issue in the community. Appreciate all of your I appreciate all the comments, your concerns, your attitudes about this issue. And at this point, I'm going to turn it back over to the board. And I need to have someone on the board tender a motion that we consider the recommendations in the 2021-22 school year opening plan that was provided to you by the administration. And once we've tendered that, we'll open it up for discussion. So moved by Deb, seconded by Kathy. All those in favor? What? We're just opening up for discussion. All those in favor of opening up for discussion? Okay. You know, this is a really important issue, so I want to provide the opportunity for everyone to have a voice in the process. Excuse me. So I look forward to this discussion, and I encourage each and every one of you to add a comment or a statement about how you feel about this particular issue. And we can pass the mic around, starting with whoever wants to begin.
I spent years teaching science. I have a degree in science and additional 30 years in graduate school in biology. I also have a master's degree in education. I feel very strongly that science makes decisions based on good information and data. I believe that the CDC does the best possible job it can. I believe that the Pediatricians Association follows information carefully. I think when scientific authority suggests that it's a good idea to do something, it's a good idea to do that something. And the CDC is not saying, we think it'd be nice if people that wanted to wear masks wore masks. They have been saying for some time that anyone who's not vaccinated should be wearing masks. I don't see that happening necessarily. I'm very concerned about people having political opinions and feeling that it's important to stand by their political opinions rather than hearing what scientists are saying. I would like this to be a public health issue, pure and simple. And in my opinion, a public health decision is for the students to start school with masks. The number of cases in this county is going up. We've seen there are cases in California too, the same. I am fully vaccinated, and I suspect I may end up having a booster shot because they're now suggesting that. I don't want to be responsible for any person associated with the school becoming really seriously ill or perhaps dying from COVID. I realize there are not perhaps high chances of that happening, but I wouldn't want it to happen to even one person in this community.
I disagree. And I will vote for no mask. I just think that we are being a little, I think we're being a little hysterical. That's my opinion. And I will vote for no mask.
I'm not sure I could not do any of those, but I've been a science teacher all my life. I've had several diseases and battled them all the time. My heart's on two sides of the audience out there, but I believe that parents need a choice. My grandkids, I have 5. I hear from them. I know the youngest one is pretty concerned about, do I wear a mask, if I don't wear a mask? Well, whatever. I just hope the kids don't tease me. I'm laying that and hoping that parents have a conversation with their child and say, we're going to wear a mask because your friend might not wear a mask because, and please don't argue or bully or harass their decision. And I think we as parents, grandparents, teachers, board members can do that. So I feel that what we have presented here tonight with, yes, the recommendation, looking at CDC and others, it does come down to a parent choice. So my decision is, or vote is, a parent choice with you parents and teachers understanding that if it comes down to the superintendent having to make a choice that we have to wear a mask, and you have chosen at the beginning for your child not to wear one, you respect her and that they will come with a mask. So that's my line and I'm sticking to it.
I too have been a teacher for almost 40 years, primarily math and science. And my concern is, how will you look a friend, a child's playmate's parent in the eye if something does go wrong? How do you have that conversation with, well, gee, it was in our building, and what kind of conscience decision do you make, if something should happen? Yeah, we don't know. There's a lot of unknowns. I'm not a proponent of masks personally. I see people in and out of the business that I work in every day. It's probably 20-80. 20% wear them, 80% do not. And I run that risk every time I step into the office where I work. Do we really want to put our kids at risk? It's okay, I did 3 years as a principal, and it's okay to start out strong and firm, and then lighten up as the years go on and conditions improve. I think we need to do, when I look at what we do as a board, we are asked to do what's best for our students. And I think what's best for our students is to start off with masks and see how it goes.
I truly wish to abstain from any side of the aisle here.
listening to a lot of the teachers and community members who spoke, who prefer masks. I'm not sure that I'm in any position to make the best decision for a whole right now.
So, we've heard some things about compromising immune systems. My ex-wife has one of those. I myself have lung issues, have been hospitalized 3 times. So if anybody should be concerned, it should be me and my family. That being said, I think these kids need to get back to normal. I don't want to see my kids wearing masks. I would also like, if the school decides to go to masks, that the school board be in charge of that vote. That's what I can say.
Yeah, it's been a long weeks with emails, phone calls, etc. And it is, I don't know, one day you're on one side, the next day you're on the other side. I think Rangeley itself this summer has done a great job on the whole in protecting ourselves. I've seen a lot of people wearing masks. I don't ever recall my grandson saying, "Oh look, there's somebody wearing a mask when they go to school." No, that doesn't happen with him. I don't personally see anybody being targeted because they're wearing a mask or not wearing a mask. I would love to see the kids come to the school in a very positive note to start with and see where it goes from there. And if we have to take action, we take it quickly. And that unfortunately will have to be done. If it does have to be done, it will have to be done by Georgia and the staff immediately. The board may not have a chance, in a timely manner, because we are all working and have other things to do. So I don't want to say disagree with you, Wes, but sometimes the timing of things is what dictates what we do. So I will turn it over to Jess.
I really hate that this decision is being put on us. I don't feel qualified to make this decision. Like Karen said, every other day I flip-flop how I feel, and that's hard. I just keep going back to what the CDC is recommending, and so far that's what we've followed this entire time. We wanted less last year, but they recommended this, and that's what we decided to go on. So I just believe that we should continue with what the CDC is saying and recommend that students wear masks but not require it. I think, like what Amber said, it's a discussion you need to have with your children and what your family believes is right. And I think I'm going to give my, if this passes, I'm going to give kids the option to wear it, and I think one of my kids will choose to and one won't. And I think they're old enough to decide based on what our beliefs are, and I certainly do not believe that they would ever form opinions on other people's choices. And if people want to wear masks, they're not going to say anything, and if people don't, they're not going to say anything. So I think if every parent has that discussion with their kids about what their family believes and values, that I think there's not going to be an issue with voting.
Clearly, this is the toughest decision that we're probably going to make as a board, and at least this year. And like a lot of folks sitting around this table, Georgia and I have had a lot of conversations that have fallen out on both sides of this issue. I agree. I believe our moral obligation is to to create the safest environment for the children who enter this building. You're turning them over to us with the understanding that we're going to protect, take care of them, and educate them to the best of our ability. I worry terribly about students K-5 or 11 and under who are unable to get a vaccine at this point in time. It's simply not available to them. I don't know what percentage of our students in the building are vaccinated. I personally would lean in the direction of mandating masking initially until we have information that would be indicative that we don't need to go there. But I would be happy to compromise with whatever the board chooses to do. So are we at a point where we need to put this up for a vote?
Can Georgia please go over the agenda?
I'm sorry,
Can Georgia go over the agendas?
Sure. So the first addendum was to take out on page 1, to take out the language and the paragraph under safety requirements for in-person work instruction, to take out the language in bold, and add the language that the superintendent may at any point in time, based on community spread and/or the situation in school, require masks to be worn, as well as implementing additional safety requirements if needed, such as maybe we go back to 6 feet distancing, or depending upon what we're dealing with.
Georgia, would it be logical for us to vote on this in parts? In other words, one of the essential questions is whether or not we are going to make masking recommended or mandatory. That's one set of decisions. Another set of decisions, because Wes brought it up, is whether or not the administrative team is going to have the responsibility or the discretion to mandate masking if there is, given factors that come into play, contact with the school, community spread, whatever those issues might be, the right to mandate masking. That's the second issue. Third issue for me is whether or not we require staff to wear masks in the building when they're in contact with students. So would the board like to vote on that in those 3 parts, or do you want to vote on the whole plan? I don't mean to make this complicated, but it has many facets to it. 3 parts?
Can I just go back and ask why the change from the bold?
We just felt that that didn't sort of really speak to the criteria that, or the different scenarios that could play out. And that this really would, I believe, Lindsay could chime in on this, but I believe this would make us more vulnerable if we got to this place than not.
Yeah, I would echo that. We're in a meeting. I really thought that Georgia, as a superintendent of the school, should have that leeway because we know something's happening. We know that, right, let's mask up right now. That we prevent kids having quarantine. So I'm going to come back to that. My whole thing here is kids in school. If we can make a quick decision that we don't have to get to work there the next day, we can continue to go to school. That's why I wanted that. And to me, that was the long-term decision, something to keep kids in school because the Roostic one day they're in school and now they're remote for a day at least. The kids are quarantined. To me, as an educator, that's a disaster. So if we can have a quick decision, keep more kids in school, that's right.
I think, sorry, can I speak? I think we could, as a board, get together very quickly on this, and have an emergency meeting within the day. The nice thing about the board setting the mask mandate is we put timelines on it, go for a week, see what we set, and then have another meeting and go from there. And that's my thought on the board, recommending that, or mandating that.
I'm sorry, Georgia. Can you reread the agendas? Because I just keep going back to what's coming and I just want to listen to what the agenda is.
That was, so you got that, the first one. So the second one states, and it would be right below that all staff will be asked to wear a face covering when working within 3 feet. at any point in time.
So we're not gonna let it get to this outbreak level. It's gonna be after there's one positive case.
No.
Not necessarily. That's why we need the flexibility to make decisions. It would be, Lindsay, maybe you should.
I think
Gives-
it's hard
some
because, originally we had put, the CDC defines an outbreak in a building as 3+ cases from different households within 14 days. And yes, that gives us a time, a number to go by, but as we know, the CDC is not always very quick with things. So by the time we get to an outbreak, we could have already maybe prevented some if we felt like, okay, so we have 3+ cases in the school or in a wing or whatever is happening, and maybe there's things happening in the community, then yes, that's great. But by the time they declare that, then maybe we're past that. So it just is, if the situation is like changing, say we're doing the pool testing and we have the antigen, and if we have to call an emergency board meeting because I just got 5 kids that came back positive, I mean, that is not really conducive to going,
My question is, what is that minimum level where we're going to be reanalyzing whether or not it should be required or not? Is it the 1 case? Or just at any given time? If the county is spiking, if the area is spiking?
There's a number of things that in the past, sorry. In the past, there was a number of things that we looked at to make determinations. We looked at the county numbers, we looked at community spread, and how that community spread might tie back to our building. If we had a case in elementary, we would be thinking about, okay, is this child maybe a sibling of a student who might be a middle schooler or a high schooler? What measures can we put in place right now to protect everybody that could be involved in this positive case?
I don't think we define specific criteria because sometimes it's hard to do that. That's why,
So it's
promise it's not
open-ended. The addendum is open-ended to be determined if there's a situation that we need to require masks. It would be solely up to you. That's how we're going to be voting.
Not solely up to me. I mean, we would obviously be working with a team,
Right.
but I would make the call, yes. And it may not necessarily be a situation in this building. It might be a community spread that could affect this building as well. So that can also be an impact.
So as part of my discussion, I'm asking a question. How do you want to go forward with this? Do you want to vote on the entire plan, or do you want to vote on those 3 pieces of the plan? Okay, I think the 3 pieces are mandate versus recommended masking. The second part of the plan is allowing the administration, considering all of the various factors that may come in play that would impact the building, making a determination that they are going to mandate masking for a period of time. And the third part of this is requiring all staff to wear face masks when they're interacting with students within a 3 feet distancing guideline. Just by a show of hands, you want to vote on the whole thing or each of those 3 items?
What are we raising our hand for?
I'm sorry.
First.
If we raise our hand, what do we say?
Okay, do you want to vote for it all in one big vote? Raise your hand. Okay, so how many want to vote on it in pieces? Raise your hand. Okay, so we'll vote on it in pieces. So the first question then is, can somebody make a motion to either recommend or mandate face coverings to start the school year? Either recommend face masks or mandate face masks to start the school year. Which, well, make a motion. Make a motion.
We would make a motion to adopt this. We would make a motion to adopt this as
adopted as reads, which means that we are only recommending, not mandating face masks. How many people are on the board are in favor of that?
For recommendation?
As a recommendation, not a mandate.
Someone's got to make the motion first.
Somebody has to make a motion, yes, that's correct. Kathy, can you make that motion in second? Oh, my goodness. I'm a little confused. Okay, thank you, Joe. So, are we ready to vote on adopting that part of the plan? Those in favor, raise your hand. Right, recommending, not mandating. 1, 2, 3, 4, 5. Okay. How many opposed to that? 2, 3. So what do we do?
I was sure to say.
You're abstaining? So does the motion pass? Georgia? She is abstaining. Oh, she has to We have weighted voting, so we have to.
I got the number so you can get the individual.
What our percentages are worth.
Right, well, I have that, I got, there were 5 ayes, 3 nays, and 1 abstention. Right, show me your hands again, and you're an aye.
Raise your hand if you're in favor of adopting recommendation.
Isn't Wes, Karen, and Jessica all Rangeley?
Yes.
So it passes.
Yes. Okay, so that passed. So it's only a recommendation to start the school year. Okay. The second then is I need a motion to allow the administration to make a determination as to whether or not to mandate masking given community factors. Okay. Karen, anyone second? Johan, okay. Any discussion on that? All those in favor of allowing administration to make that decision, raise your hand. And all those against that motion? Yes. So that motion passes, is that correct? Okay. And the third portion of this then is to require that all staff will be required to wear a face mask when working with children within a 3 feet distance. Okay, moved by Deb, second by Johanna. All those in favor, raise your hand. Okay, that motion passes. All right. Our next meeting is September the 14th, 2021. Thank you for being here, and we appreciate the public participation.
Ha ha ha.